Hello, everyone, and thank you for joining today's webinar, Countertops on the Threat of Silicosis, the Role of NKBA Members. My name is Alicia Kidd, Program Manager of Virtual Events at NKBA. As we continue our theme of surfaces and texture for the month of March, please join me in welcoming our speakers from the Natural Stone Institute. We have Jim Heeb, CEO, Mark Mario, Accreditation and Technical Manager, and Dacia Woodworth, Architect and Design Community Liaison. Team, please take it away.
Great. Well, first of all, we want to thank you for this opportunity. There is so much synergy between the natural stone industry and the kitchen and bath industry. Mark, Dacia, and I had the privilege of being with many of you at KBIS in Las Vegas last month, attended your awards ceremony, and also met so many of you in our educational session that we offered. And today we come together to talk about a very important topic, which you have a lot of influence that you can help our industry become safer. You know, for many years, I've had the privilege of working with Bill Darcy and collaborating about discussion. And we have so much deep respect for the research that NKBA does, and also just the design work that you all do. So it is a pleasure to be with you today. I'm joined by two industry colleagues who have lots of industry experience, and I'd like them to introduce themselves. Dacia, can you give us a little bit of background about yourself?
Absolutely. Dacia Woodworth. I'm the Architect and Design Community Liaison at the Natural Stone Institute. I just am starting my 8th year here, completed 7 years with the association. Prior to that, though, I've spent most of my life in the built industry from 1994, gosh, that's dating me. When I graduated from the University of Texas, all of my jobs, everything I've done has been in the built industry. And luckily, I found my passion in the stone industry in 2001. So like Mark, I come from industry. I work in association now, but I definitely understand all of the components of the things that you all work with every single day.
And Mark?
Dacia mentioned, I also came to work at the Institute from industry. I was in countertop fabrication since 2002, where I had my own shop for a number of years, and then worked for progressively larger and larger companies doing countertop work, both residential and some light commercial for a number of years. But I'm also in my 8th year with the Natural Stone Institute. You can tell by all these logos around here, kind of some of the things I do. I manage our accreditation program we'll talk about in a little bit. And then I also manage our safety committee and many of the resources like silica safety that we'll be talking about today.
And I'm Jim Heeb. I'm the CEO for the Natural Stone Institute in my 24th year. And we have brought together for you Mark and Dacia because they are the ones that interact. Mark is our safety guy. Dacia is our person that makes it happen with the A&D community. So Mark, we've got 3 learning objectives that we hope to accomplish today to bring the NKBA membership up to speed and to provide them with resources and a better understanding of what's going on with silicosis. Can you please cover them?
Yep, these were in all the emails you guys have received, reminders, but we're going to gain insights into the dangers, talk about silicosis itself, and the dangers it presents to workers in the countertop and bath industry. We'll talk about employee safety resources that we at the Natural Stone Institute have available, and then also how you can help as kitchen bath professionals in understanding the risks and working with companies that can minimize exposures for their employees. Work for a safer community that we're in.
So silicosis is certainly in the news. You're hearing about it from Australia to California and elsewhere. But obviously, Mark, it's not something that's new. It's been around for a long time. So can you give us a little bit of a history lesson about what is silicosis and what's the highlights we would want everyone in the design community to know?
Yeah, it's not a new thing. Silicosis was discovered back in 1705 by this gentleman with the fine looking locks there, Bernardino Ramazzini. who is more famously known as the father of occupational medicine. He noticed sand-like substances in the lungs of deceased stonecutters. So he was able to identify this way back then as a disease from workers working in the stone industry. More recently, but still quite a few decades back, the Hawks Nest Tunnel disaster is a large-scale incident of silicosis from the 1930s, so almost 100 years ago. It's considered one of the worst industrial disasters in American history. About 5,000 workers came to West Virginia to dig this tunnel, and the dry drilling techniques that was used released large amounts of silica dust into the air, and silicosis claimed the lives in that project of at least 764 workers. And when understanding silicosis, there are three types. It can develop over a long period of time, as listed here. The physicians designate them as chronic silicosis, which is developed over a longer period, prolonged exposure over a long period of time, may develop slowly and is the most common historically type of silicosis. But it can also develop much faster where higher exposures are encountered. And this is kind of what we're seeing today from some of the cases from accelerated silicosis and acute silicosis, developed from within much shorter work periods to moderate and higher levels of silica dust. Acute silicosis is over a shorter period from a matter of weeks, but those are extreme high exposure levels with rapid onset of symptoms and very little safety protocols in place. So understanding what causes this awful disease, this image shows relative particle sizes. On the left, this is just dust from hard surfaces created in cutting processes. But the largest inhalable particles are in that 30 to micron range. And over on the right-hand side is a representative, graphic showing what a relative size, like a grain of table salt, might be in these relative sizes here. But the respirable crystalline silica particles that causes silicosis are the ones under that respirable fraction, the under 10 microns, the really, really small, fine particles that travel deep, deep within the lungs. And then what happens, this is similar to what Ramazzini discovered. This is an image of a miner's lung with silicosis and tuberculosis from the Basque Museum in Spain. But silicosis is caused, as we just saw, by those very small, unseen particles of crystalline silica that are inhaled deep within the lungs. The human body cannot process crystalline silica and reacts by scarring over those microscopic particles, resulting in permanent loss of breathing capacity. Symptoms of silicosis can be similar to other lung diseases, making it difficult for early diagnosis. And they can include things like fever, cough, weight loss, loss of appetite, trouble sleeping, chest pains, increased amounts of phlegm, nails with a bluish tint, or severe breathing difficulty. Silicosis is horrible, but preventable with proper safety protocols in place.
And so that's a lot of what Mark's just described is kind of, it's been around a long time. So we don't want any of you to walk away from what you're hearing in the news today impacting our industry, that it's a new thing. It's been around a long time. And the industry's also been able to put in place safety measures and best practices, obviously working with our government officials. But Daisha, let's give Mark a little bit of break from kind of the history. And, here at the Natural Stone Institute, we work a lot on the mining side with MSHA. We work with OSHA across all the states, but we also work with an organization called NIOSH, which is part of the CDC. Daisha, can you give a little bit of perspective of what this slide is saying and why it's important for our design community to know?
What this slide is telling you is that most of, or many of, a large percentage of the countertop materials that we fabricate have silica content. As you can see, it ranges hugely from 10% to in the high 90s. But the point is that It's there. And we have, through the last many decades, learned how to avoid that exposure. And that's really what we're here to talk about, is that, you know, you could go outside on a windy day in Arizona and get silica exposure far greater than any, any of these particular materials being fabricated, because it's respirable and it's out there. Then this is just to give you an idea of, the different levels of silica in the materials that we fabricate. And this isn't everything. As you know, there are many, many, many other different materials that are fabricated for countertops.
Yep. Mark, you've done a lot of training around the country on this topic. When you've presented this slide, what are some common questions that have been posed to you, and what additional perspectives do you add with this slide?
I mean, we know what materials are popular right now. The headlines all isolate or look at things like manufacturer engineered stone, but we know natural quartzites are very, very popular in designs these days. And those are naturally occurring crystalline silica bearing materials with potentially high levels. So we know this is a concern for all of our workers, but part of what we wanted to convey through this slide is understanding that when you design using these materials, understand there is a potential for some risk to those workers. When you use things like marble or limestone, they can be potentially much lower. Those are not even on this chart because they're usually very low to undetectable levels of crystalline silica.
Correct.
Dacia, as we move on, there is really a strong message we want to say to consumers, because we do get calls from consumers and say, I saw the headline. Do I need to be worried? What message do we want to convey to our audience today?
Absolutely no worries for a consumer. This is strictly about taking care of the people that work with natural stone, the people that cut it and finish it. It's about protecting those employees and the people that are our artisans in our industry. So absolutely not. It has to be respirable in order to be, to affect the lungs like that. And as you might imagine, it's pretty hard to make anything from your countertop respirable in a home. So no, it's absolutely not a concern for a consumer or anyone really that works in a built environment, except for the folks that are actually cutting and finishing these materials.
You're going to learn later in the presentation, we have a lot of resources that Mark and Dacia are going to highlight for you that are really designed for the fabricators, but they're great resources for you to be aware of as well. And Mark is going to be talking a little bit later about a specific web page that we have around this. But to echo what Dacia just said, one of the first things we do at the top of our silica page on our website is to make an acknowledgement that this is an occupational hazard. Consumers, your customers, the end users, should not be worried about it. But obviously, we want them to be aware of you can influence best practices by the fabricators that you select. So, Mark, there's been a lot of news in the headlines. Australia's banning materials and a lot of stuff going on in California. Can you kind of walk us through what's transpired in the last 18 to 24 months?
Yeah, the U.S. awareness of silicosis kind of started out of California. The California Department of Public Health is one of the more advanced public health organizations. They have a reporting network in place, I'll show you in a minute, that helps health professionals better identify lung cases for earlier and better treatment. California was part of an early nationwide alert called an MMWR, Morbidity and Mortality Weekly Report, one of the first news articles that went nationwide, published in 2019. It included a report of 18 silicosis cases in 4 U.S. states, which were California, Washington, Colorado, and Texas. And then more recently, Australia enacted a complete ban of artificial or engineered stone products that went into full effect in July of 2024. It's unknown how effective that ban is going to be at protecting workers, because we know there's other materials that contain silica. It'll likely take months to years to determine if removal of a single product will reduce the number of silicosis cases in countertop workers. Moving on, one of the biggest contributors to unsafe work conditions are what we consider non-OSHA compliant facilities. The images shown here are from a CBS News story of extremely unsafe shops in Sun Valley, California. Shortly after the initial airing of these images and this news story, Cal OSHA was able to visit multiple similar facilities and issue orders for them to stop work until work conditions were improved or within compliance. So we were able to help them identify areas or shops where this stuff was occurring that the CBS News story covered, and they were able to affect. So some of it is the responsibility of enforcement as well, being able to get out there and visit the companies and find the ones that are non-compliant. I mentioned in California, they're one of the more advanced public health organizations in the country. They have a live online data page, or I say recent online data page. It's maintained by the California Department of Public Health. One of the reasons that California is so advanced is they've set up systems like this and made physicians statewide aware of silicosis as an issue. So we expect cases from other states could also increase as more awareness spreads throughout the medical community, as they become more diligent in identifying lung issues. I mean, because some of these symptoms are similar to things like COPD from smoking and other things. And so, like I said, it's a shared responsibility in finding and identifying these cases. But you can see in California, they currently have 258 documented cases of silicosis workers. Have experienced 15 deaths. And down on the bottom, if you can read that number, it's 30 lung transplants right now. They have other data on this page about the median age of the workers, relatively young. And you can see on that chart, as surveillance has increased and they've identified those cases, has really grown since 2021, has really spiked up.
You know, when that CBS News and anything that you've heard in the news, when I see those pictures of these fabrication facilities filled with dust, that's not the industry that I know. But unfortunately, some of those bad actors out there are obviously not taking the steps necessary through best practices to be compliant with the regulatory agencies. But that's not the industry I know, and I hope you will remember that picture, because in a little bit, we're going to show you a couple other pictures that really should showcase, you know, the fabrication facilities that you're working with. And I'm sure many of you, when you saw that picture, said, well, that doesn't look like the fabricator I'm working with, and thank goodness. But there is a lot of litigation in California as well. And there are plaintiffs' attorneys that are actively going out and working with in our employment base to bring the lawsuits against fabricators and ultimately the material suppliers as well. So a lot of lawsuits, a lot of activity. And so we continue to be aware of what's going on. And, you know, no doubt the regulatory agencies, because of this heightened awareness, have stepped up their enforcement as well. You'll see in the bottom picture, you know, recently, and, you know, this was a fabricator in California that $1 million in penalties. Now, truth be told, a lot of
that was in Chicago, Jim.
Chicago, excuse me, in Chicago. A lot of offenses. A lot of repeat visits to that fabricator. But this is what's making the headlines right now. So we do anticipate there'll be more lawsuits. We do, but we're also hopeful that the enforcement folks will step up their game and help us. I often say it's a lot like if I like to drive fast in my car, and I know that there's a strip of highway that the police officers never patrol. What am I going to do? I'm going to drive fast. And, you know, good drivers, they're following the laws. You know, there's a lot of similarities in that. Now, also in California, and Mark, if you could talk a little bit, because California probably has the most restrictive procedures right now impacting our industry. But Mark, can you walk our design community friends kind of through what's going on with the most recent silica standards and the requirements that are placed on fabricators today?
Yeah, so because the California medical community is a little further along at identifying early cases, and they deemed an epidemic in that state and possibly nationwide. In response, the regulatory body in California, they have their own division of OSHA, Cal OSHA, decided to step up the compliance rules for silica for workers who might be exposed to silica. So a little over a year ago, throughout the year of 2024, they had what was in place, what they called an emergency temporary standard, where they really stepped up efforts to protect workers. Some of those requirements are on here because at the end of last year, they passed some new permanent standards for the state of California that are far and above, much stricter than the federal OSHA compliance, which is what governs compliance in most of the other states. But in California, they have requirements for regular air monitoring is a requirement every 6 months. Requirements for employee medical surveillance, meaning that the employees have to go and have things like chest x-rays and lung function tests performed so they can monitor the health of those workers. Requirements for respirator use. So even in shops that in other states may be compliant with the federal standard through wet cutting and some of those methods, they still have a requirement for certain levels of respirator use throughout the state of California. So for those of you in California, when you do visit your fabricators facilities, they should be wearing some type of respirator. And then additionally are additional requirements for reporting, signage, warning signs, things like that in those facilities. So those are some of the things you can look out for if you're in California.
I think so. One of the things you might be thinking naturally is wait a second, if OSHA itself has said this is preventable and they have guidelines for what is permissible in terms of being respirable, why on earth are we still having all the problems that we're having? And is there a solution that might make this work? So we wanted to highlight just briefly some legislation that's been proposed in California that we believe may be one of the key tools to help drive down the frequency of silicosis cases. And in essence, it is a registration or a licensure program. And what it says to the fabricator is you have to be licensed. You have to have demonstrated that you've gone through a variety of training. You also have all the compliance issues with OSHA. You're doing all wet practices, air monitoring, no dry cutting. And remember, that is what we largely attribute all the problems to, is the dry cutting, grinding, and polishing that's happening in some of these facilities. So the fabricator itself would have to demonstrate compliance, do all these things, they'll get a license. And then for the distribution community, whether you are a manufacturer on the engineered man-made stone division, or you are a stone distributor distributing multiple building materials, including natural stone, you could only sell to registered fabricators. So that concept of controlling the issue through the supply chain is what's currently being debated in Sacramento, California. And we're anxious to see the outcome of that. But we as an industry are certainly advocating for that practice because we do need to partner with public health. We need to partner with enforcement and the regulatory agencies to do our part as an industry to control it. And we believe something like this is something that should be strongly considered. Mark, you've engaged a lot of these conversations with us as well. Anything to add on this?
Just that anybody interested in more information about this, the sponsor is, I believe, Senator Menjivar, and it's officially the California Senate bill, or SB 20. You can search that and find information about the current bill that's been proposed. And a couple of the key issues that we've seen in some previous legislation are both the funding of such an activity and such a system, And then, as we mentioned before, the responsibility of enforcement, not just OSHA, but the enforcement of this type of registration system. So those are other issues that we're trying to work with the legislators to get a better understanding of what it might cost and how we can cover those expenses through fees and training and possibly add-on fees for the products.
Yep. I mentioned earlier, we showed you a couple pictures from some very dusty fabrication facilities. This picture is obviously very different. Mark, can you kind of share a little bit of perspective of what this picture is telling us?
Yeah, the biggest difference is, and I hope when you're interviewing or working with fabricators, you're working with ones who are using all wet fabrication processes. In this photo, you can see the moisture on the floor, the water used. They have strip curtains to isolate the work areas where silica might be from other folks going in and out of the shop. Just an overall clean and organized facility. Noticeable safety signage, material or SDS books, safety data sheet books available within the shop. Other things you can look for that may be in use would be PPE, respirators. But understand that compliance in a lot of states outside California, that if they're a really clean shop and have testing information, respirators may not be required in the cleanest shops, but it's something you can look for. You can also ask the managers and the folks in those shops about safety training. Ask a shop worker, not just the management. Hey, what do you know about silicosis and silica exposure? What are you guys doing to protect yourselves? Some of those questions you can ask when you're visiting a shop or considering working with a shop fabricator.
When I think about all the work we've done as Mark, if you could go back to the previous slide, thank
Yep.
you. All the work we've done to educate public health, the design community, the regulatory agencies about our industry, I keep coming back to this one common theme. Picture yourself walking into a fabrication facility that has 3 saws. On one saw, it might be a porcelain material, very popular in the design community. The other saw, it might be a natural stone material. The other saw, it might be an engineered stone material, okay? The bottom line is we're dealing with respirable crystalline silica dust for all products. There are very few fabricators that only fabricate one type of material. And that's really important for you to understand that. So when you hear your fabricators or industry like us talking about what's acceptable, you know, we're turning to the federal and state guidelines around their action levels and their Pell limits. You'll hear us talking about that. So the regulatory agencies have defined what's acceptable, and that's across all building materials. So some days that fabricator might be fabricating a marble, which is very, very, very low, if any, silica content. It might be fabricating an engineered stone that has a lot, or a quartzite. It might be somewhere in the middle. So just keep in mind that a saw in a fabrication facility doesn't discriminate against what type of material it is. It's just cutting material, and it's the controlling the dust that is so, so important for all of us. Now, Mark, for years, let's talk about that relationship that we have with fabricators, ultimately your fabricators. And we've been focused on safety for a lot of years. Can you kind of provide an overview of what resources we have for fabricators? Because I know our design community friends are going to want to know this, because they're going to want to make sure their fabricators are doing all the right things. So Mark, can you take it from here?
Yeah, we've always had safety resources available, even back to when I was a fabricator and a member company of the former NSI, the Marble Institute of America, going back a few years. But there have always been safety resources available. But about 3 years ago, as the silica issue came more evident in the headlines, and we knew the cases were rising, and that we decided to package the silica specific education and compliance information to help our members and fabricators understand the new OSHA, new in 2016 OSHA rules for compliance. To better understand and comply with those, we put together some silica specific educational courses, along with general OSHA compliance courses. And then another issue within our industry specifically is slab handling. I still get reports on a regular basis of slab handling incidences where unfortunately workers in our community end up awfully being fatally wounded or injured other ways in slab handling incidents. So we wanted to keep those two topics highlighted together, and we put them together and created a silica and slab safety certificate program. And anywhere on our website where you see this little shield logo on my shoulder or on the slide image here, it'll get you to these resources, to the certificate courses. It's 16 individual courses. The links are on our main webpage, naturalstoneinstitute.org, our safety pages. So it's 16 individual courses that we updated in 2023 that more specifically focus on silica and slab safety. And we've also done a number of live training events started last year in 2024, and we've already had a couple this year. And since we've revealed or packaged this certificate, we've had over 1,200 industry workers who have taken and earned this training certificate. I will say for these courses, for the full certificate of courses, there is an admin fee for non-NSI member companies. It's one of the benefits we provide to our members is having free and open access to all of it. But I did want to mention that all of our safety resources, including all of the individual courses in this certificate program, are free and available to anyone in the industry, member or not. So they can learn about OSHA compliance, they can learn about safety, but in order to qualify and for us to administer that certificate, we do charge an admin fee there. All that information is available on any of the pages where you'll see that certificate logo.
Yeah, and Mark, I would say safety is so important. We didn't want the cost of the training to be a barrier for, the smallest of fabricators, that might be in your community to be a barrier. And Mark, we've been doing a lot more than just training. Can you talk a little bit about some of the science that's been done most recently in the last 2 years and additional resources that are coming?
Yep. We partnered with another industry association, ISFA, and together our members and our foundation and our safety committee have all helped us raise funds to fund some research that we've contracted with the Yale School of Medicine. They are working on a number of projects. I'll talk about just a couple of them here. One of the biggest ones is we conducted a industry-wide fabricator survey where they collected, I pulled some early numbers. The formal report is to be published soon, but some of the early numbers or that we received back from those industry members, 266 surveys across the industry from 45 states. And then of those 266 surveys, we had 49 shops that had conducted historical air monitoring or air sampling. And that's a method of analyzing the exposure within the shops. So we had 49 shops in 26 of those states that had conducted air sampling events, and Yale was able to compile information from 288 usable samples or individual air sampling events. So that report will be out later this year because it's coming from Yale. It'll be submitted to trade magazines, the School of Medicine, and when I say trade, I mean the medical trade, for peer review and analysis of the data. But that'll be out later this year, I anticipate. But when they were gathering all that information in that survey from members across the industry, it was discovered that there was a huge variability in some of the descriptions of workplace events, some of the test time for those air sampling, and many other details. So some of the early actions we saw a need for our members and other folks in the industry was for some guidance on what to do for air sampling and some general standardization for the reports and recording of this information. So again, one of the early products we created with Yale's help was on the left is a guidance for fabricators to understand what workplace silica exposure assessment should look like, things they can do to prepare themselves. And then the one next to it in the blue is a little more detailed, but it's a document that those fabricators can hand to a testing agent or a certified industrial hygienist so that person understands all of the details and data that we hope they would collect during an air sampling event.
Yep. And so I think the big thing you might be thinking, okay, why does this all matter? Why this all matters is your fabricators that you're working with. We've had training available for years, and Mark in a second is going to talk about how you can help. But obviously, we want you to know that we are leading a lot of additional research that does not exist. We're providing resources to our fabricators, and we want you to have access to all of that as well. And that's why we've made it public on naturalstoneinstitute.org/silica. And all those links will be made available to you post this event. We are spending a lot of money because it's the right thing to do, and there's more to be published. We just commissioned a number of additional publications to be published and to go, but now we want to kind of segue and say, what can you do to help us and to help our industry keep our employees safe? And so, Mark, there is a combination of training, access to documents, and just general things that our design community friends should be asking and talking to their fabricators about. Mark, can you kind of cover that now for us?
Sure. So professional credentialing is one of the things we do within the stone industry. So similar to NKBA having their CKBD or the Certified Master Kitchen and Bath Designers, we have credentials that can be earned by our members. The big one on the left is what we call accreditation. So this is a company credential that can be earned, but there's a number of steps to qualify as an accredited company regarding technical understanding, technical abilities, the physical shop facilities review, customer service, quality control, business practices, financial stability, and then, of course, responsible human resources and safety are including requirements for state OSHA safety compliance, are requirements in order to earn that accredited seal. So we have over a 100 accredited companies across the nation. These are some of our better members that you might seek out if that's a concern of yours, both for project quality and for safety. And then on the right, I already talked about the Silicon Slab Safety Certificate. So this one is earnable by individuals across the industry, but you can ask them as simple as do you know about it, or have you taken these certificate courses? So they may be able to produce a certificate like the one shown here to show that they've earned, they know and understand and are at least understand the risk and are working to minimize it in their facilities.
So Mark, obviously turn to accredited fabricators. If one's not in your area, turn to a fabricator that's focused on training and all the best practices, with their employees. Mark, what are some questions that the design community, our kitchen and bath dealers should be posing to their fabricators to help heighten the sensitivity around this and help us get a better handle around this issue?
Yeah, so if you're interviewing new fabricators or even the current ones, you can ask them questions like these. Do you have a written safety program in place? Have you had air monitoring performed? And that's where OSHA or industrial hygienists come in and place little sampling devices on the workers around the shop. Have you had your employees medically evaluated to make sure that they don't have a risk of silicosis or early stages? And then, or you could just ask them more generally, what safety protocols do you have in place? And some favorable answers might include that all wet fabrication processes. So that's a good first step, but it doesn't guarantee low enough exposure. So that air monitoring is really the only way to know and understand what the exposure looks like for the employee and for their lungs. But all wet fabrication processes, I mentioned, overall clean and organized facilities, the safety signage and material safety books, PPE respirators I also mentioned may be in use at those. But again, it may be not required if it is one of those cleanest shops that does have the air sampling data showing they're within compliance. And you can also inquire about safety training, not just management, but ask the workers on the shop floor if you have the opportunity to talk with them.
Mark, I think everyone understands the word influencer, and who doesn't want to be an influencer? Every day in your course of being a member of NKBA and a kitchen and bath professional, you are influencing outstanding design. Now you have the opportunity to also influence through your fabricators that the best practices around employee safety are being deployed. And that's what we're asking you to do here.
Mhm.
Now, throughout this whole seminar, we've been talking and bringing you up to speed on what is silicosis, what's happening in our industry, what is the industry doing to influence it. We've showcased best practices and all the work we're doing as a industry that takes this very, very seriously. But we do a lot more for the design community than just advocate for safety. And we wanted to close before we open it up for questions to let Dacia showcase a little bit more about all the additional resources that you can be taking advantage of from the Natural Stone Institute. So Dacia, can you kind of highlight some of those resources? And I hope you all get excited about, there's more than just silicosis and safety that we do.
Yes.
Dacia,
Yeah,
before we
go
move on to
ahead,
those
Mark.
resources, are there any other questions you might ask or suggest that can-be dealers ask of their fabricators to help qualify them, make sure they're working with the safest folks in the industry?
Absolutely. I mean, visit those facilities.
Oh, good point. Yeah.
You know, you saw the two different pictures. It's pretty quick. It's a quick survey. All you have to do is just scan the area to see, you know, do they appear to care about their employees at the level that they should. That would be that's the quickest, easiest. And it's also really great to get to know your fabricator, because they can solve a lot of challenges for you that you might not ever even imagine possible. What I like to say about the stone business is that we are incredibly passionate people. We love stone and we love to work and create. And you guys are the creatives, you're the visionaries, and it's our passion that's really, you know, that drives what we do. So get to know your fabricators, and then you can know a lot more about, do they care? Are their employees' safety at the top of mind? And like I said, it's as simple as walking into their fabrication facility and being able to tell that quickly. So I mentioned your vision and our passion. We have so many resources. I could give you an entire hour of just listing our resources, but there's a few that we really want to highlight for you. Mark already mentioned our accreditation program. For those of you that are very interested in sustainability, we also have a credentialing program for sustainable quarrying and production practices. So if you're interested in learning more about the sustainability of natural stone, we also have all of those resources available to you. We have a beautiful, stunningly gorgeous physical publication that we produce twice a year. This is coffee table quality magazine, and it's free. And before I go any further, all of the things that I'm going to talk a little bit about today, they're all free to design professionals. We want you to succeed in your business, and therefore we want to make sure that there is no barrier to getting the information to make your projects successful. So everything that I'm mentioning is free, open access. That Building Stone magazine is free to design professionals. If you're interested in receiving that, you can see on the web, go to our website, naturalstoneinstitute.org/Building Stone magazine, and we'll get you signed up. We also have unbelievable number of document resources for you in our Natural Stone Resource Library. There's, I think, 361 publications in there, including our Dimension Stone Design Manual. That is it's a resource. It's really big. It's really thick, but it's all downloadable, free to you. Our technical director calls it the Great Big Book of Everything. For those of you that have children our children's age, you'll know all about what the Great Big Book of Everything is. Also, we have the physical publication, the Building Stone magazine, but we have an incredible resource called usenaturalstone.org. It is a website that has countless articles that will help you in your design, in your vision. You'll learn about quarrying, learn about different materials and their characteristics, and it is as beautiful as the publication, but it's always there for you on demand. For education, we have 3 different ways that we educate design professionals. We have about 10,000 educational experiences a year through 3 different programs. One is our CEU courses. Those are delivered live or via web from our member companies. They're certified to give our CEU courses that will give CEU credits for AIA, ASLA, USGBC, ASID, NKBA, and LACES, which is the Landscape Architects Group. So those are live, and those are given by our member companies. We also have 14 live webinars that we give a year. Next week, I'm so excited to host Alabama Stone for one of our 4 virtual quarry tours that we give each year through our webinar program. And then we also have our online university, where we house recorded webinars and recorded courses for on-demand credit for CEU credits. So there's 3 different ways. And also, the trade show speaking engagements, but 3 ways that we deliver over 10,000 educational experiences a year. There's countless more things. I encourage you all to reach out to any of us, Jim, myself, or Mark. All of our email addresses are our first name at naturalstoneinstitute.org. Please reach out to us. We would love to share. Again, like I said, this is a group of incredibly passionate people, and we like to talk stone all day long, every day. So please reach out to us. For the next live opportunity to meet with us, we will be at Coverings next month in Orlando. Our booth is 4491, and we will also be delivering educational programs on the fabricator stage. In addition to those, we do have 4 courses that we will be giving at Coverings. Those are the classroom courses. So come visit us. Again, we like to talk shop, so reach out to us and with any questions you might have. And we definitely look forward to seeing you again next year at KBIS.
You know, when we were at KBIS, we loved attending the awards ceremony. And we, as an industry, also have an awards ceremony, and we have a kitchen and bath category.
We do.
So please, if you are proud and want bragging rights from the stone industry, work with your fabricator to submit some of your outstanding projects for an award. And again, great bragging rights. But hey, we've come to that time where we've not only talked about silicosis and showed you all the resources we have, but hopefully also got you a little bit excited that, you know, we are the NKBA of the stone industry. And so we have lots of resources, as Dacia said, at no cost to you as a design professional. But we know there were some questions posted, and you may have questions that you want to ask. So Alicia, we're back to you to say we're ready for questions.
Amazing. Thank you all for sharing this information and all of these resources with us. I've learned a lot, and I know our audience has too. Before we dive in, I just want to let everyone know they'll be receiving an email at the end of today's presentation with all of these wonderful speakers' emails, websites, and also these slides. So you'll have access to all of that by end of today. With that being said, let's dive right in. We have a lot of questions. The first is, you touched on this a bit regarding your list of accredited fabricators. How often is accreditation updated or kept current? If there are new laws, do fabricators need to be recertified?
Mark?
Yeah, we recertify our accredited companies on an annual basis. There's a renewal process, and then they are also, again, required to maintain compliance with the state safety organizations, usually OSHA compliance office within their state where the businesses reside.
Yeah, there's a key safety element. I know there were some questions posted about Canada as well. Is we also work closely with fabricators in Canada. So, a lot of similarities between the safety side of Health Canada and OSHA here in the States. But Mark also has accredited fabricators in Canada.
Absolutely.
That's amazing to know, especially things are ever changing and always being updated. So that's great to hear that they have that assurance. Following these protocol fabrication standards, would those fabricators also qualify for well building standard, especially if there is minor field installation?
Daisha, are you aware of that? I will say that briefly, we didn't get into the minutia of compliance, but there's two
Right.
standards within OSHA. One is on the fixed fabrication facilities called the General Industry Standard. That's where the majority of our resources were created for guidance with that General Industry Standard because there was a hole in or a need from our members to understand how to work safely within their facilities. For compliance with workers in the field, there are some different compliance standards. The most notable one is creating a training document that OSHA calls Table 1 that outlines all the different activities that might take place in the field, from cutting or drilling, whatever that is. And then any prescribed engineering controls or safety methods that the company requires, whether that's
Correct.
a collection device or PPE, a protective mask or protective filter. So I'm not sure on the well building if what the requirements are for meeting that requirement, but I would think it would be closer aligned to the compliance with the what they call the construction standard
Correct.
Yes.
under OSHA.
And we could certainly look at that
Look
further
into it.
for you.
Yeah.
Mhm.
Amazing. Our next question is, why are some fabricators not pushing for wet cutting? Is it a cost issue? Is it just not a concern for safety? Why do you think more fabricators aren't getting into this for their workers?
I wish I knew.
Yeah.
I'll say way back when I had my own shop and employees over 15 years ago, I had a zero dry cutting ban. If somebody dry cut in the shop, they'd be sent home for the day. Some fabricators claim they need to see the workpiece a little clearly, or they claim that it's faster to work the piece dry. I've heard all the excuses. The reality is there's tooling, equipment, and safety methods available that just about any process, I don't know of any that can't be performed via wet process. It may take a little more time, or it may involve a step of drying the piece to check the level of finish or something like that. So in some cases it might take a little longer, but the excuse of needing to fabricate dry is gone away.
And one of the additional guidance documents we're working on is how do we help those fabricators who are doing a lot of the right things, but they're still doing some of these dry practices? How do we segue them to be completely wet, and to understand the cost? So that guidance document will lay out, here's step one, here's step two, here's step three, here's the range of cost, here's suppliers you can go to. So, we are working on that. We'll be publishing that fairly soon to help those that aren't quite there yet, to get them to all wet practices and being in compliance with the regulatory agencies.
And that's why webinars like this are so important, because if a designer goes to a fabricator and they have these excuses, why would they know any different? So it's
Right.
great that we have these educational resources so that way they know those are just excuses. They can be wet cutting, they can be, adhering to stricter safety measures. So I appreciate that.
You bet.
Absolutely.
Our next question is, can you comment on companies who are investing in making zero silica versions of quartz? If you have any thoughts or opinions on that specifically.
I will say that manufactured products do have the ability to change their formulations, to
Right.
alter their products. we're strictly a natural stone organization, so that's another reason our focus has been on the safety for our members that work with that are working with natural stone, because it as a product cannot be modified. It comes from the earth as it exists. And so if there's a risk, we want our members to know about that and to use every available resource to work with those natural products safely. So unfortunately, I can't make any other comment on the manufactured materials other than they do have that ability to change their formulation
Yep.
and reduce the silica content in many instances. But what they're replacing it with, we don't know yet. If there are potential other health issues with those replacement materials or chemicals, we don't know yet.
We won't know for a
Yeah,
while.
that'll be
That's
a
a
while.
that's a
And
really good note because you only think about the positives and there are potential setbacks as well with that engineered material.
Mhm.
Yep.
And so what's so key is just to remember that let's continue as an industry to focus on being in compliance with regulatory agencies, providing the resources and the tools that we can for training, and when there's science that needs to be advocated for, that we're working on it together.
Amazing.
Absolutely.
Now we do have a few questions about porcelain. So I'll ask these two questions and let you guys answer. The first being, now that porcelain countertops are becoming quite popular, is the risk percentage the same as other materials noted earlier? The second question was, what are the health risks associated with entering a job site where porcelain tiles are being cut?
Yeah, Mark, I mean, I have the comment to say this. Remember, whatever's popular, it's not the only product. And so
Right.
that's why when you look at the regulatory guidelines established by federal OSHA, state OSHA, Health Canada, they're looking to make sure what is being breathed is below this level. And my example of 3 saws, one's porcelain, one's natural stone, one's engineered stone, it's not just about the product. It's about the best work practices that are happening there. And Mark, anything to add beyond that?
Just that I know that many of the porcelain manufacturers are similar to the engineered stone manufacturers, do have the ability to adjust the mix or ingredients in their materials, and many of them, my understanding is they use what's known as amorphous silica, so a non-crystalline form of silica that doesn't have the same health effects as crystalline silica. But the only way to know that exposure and to reduce, know where a risk is present is to have that air monitoring done. And we also know that our fabricators are not just, like Jim mentioned, they're not just fabricating a single source material. They're fabricating stone one day, some quartz another day, porcelain another day. So it's a mixture of exposures, a mixture of materials. So really that the only way to know and understand and prevent ongoing exposure would be to have that air monitoring done and know what those exposure levels look like. And they can do it on multiple or different days with those different materials to better understand those
Correct.
risks.
And that kind of goes back to what you're saying about visit, talk, see how they run
Yes.
those shops.
Yeah, absolutely. I mean, we're the biggest advocates for natural stone, and I get asked all the time, do you have an opinion on this product or that product? I have an opinion on employee safety, and let's do the right things for employee safety. And I do
It
want to
doesn't
go
matter
back.
what you're fabricating or
It-
cutting
it-
in the field or anything.
that's
Let's just
right.
take care of everybody.
Let's take care of everybody. And that's why we use the word influencer. And I thought when we put the title together for this session, the role of the NKBA member, we could have easily put in there how to make NKBA members influencers. It's the same thing. So great questions, though. Great questions.
Yeah, I'll
absolutely.
follow up one more to add there. It's not
Sure.
just the countertop industry that's affected
No.
by silicosis. It's things like concrete cutting, concrete coring, road work, anywhere where they're cutting any silica-bearing materials. But I know you said porcelain, so some of the ancillary products like the mortar mixes and things like that, which used to contain more crystalline silica, they're also reformulating those products as well, to reduce the silica content within those. But really, we just want to, like Jim said, preach best practices for any material to keep workers safe in all scenarios.
Amazing. Our next question is, you touched on California being a pioneer state in silica safety. Can you touch on some other states and what they are or aren't doing to improve safety measures? Maybe states that are particularly bad or that people should be more aware of, or maybe other pioneer states that are really pushing legislation.
You know, yeah, this is a hard one, but I
It
think
is.
this, California is unique, just because of the cases that are coming forward in California. You know, we have companies in other states. They look at what's going on in California and they say, "What the heck's going on there? We've been doing all wet practices. We've been doing air monitoring for years. I don't understand it." You know, but there are pockets of communities where we're seeing, you know, a more prevalent use of dry practices, and that's what we're trying to address. What will be interesting to watch is what other states do as they watch and monitor California. Do they stick to the guidelines they have today, or do they put in place these more restrictive guidelines for the employers with their employees? You know, as Mark or Dacia said, you know, you walk into a California facility, if you don't see the fabricators wearing masks, you know they're not in compliance with the state guidelines. So this is going to be a little bit of a watch and see thing. And again, half the states in the United States follow federal OSHA, the other half, and again, I'm using round numbers for generalization purposes, have their own state requirements. But Mark, we're going to continue to watch this and work with the regulatory agencies across the federal government and in Canada as best we can, you know, to be a part of the solution. There is not one single individual or company that can do this on their own. We all need to be working on this together. And that's why when I sat down with Bill Darcy in January and we talked about the tremendous work being done by both our associations, that's why bringing us together to do something like this today was so important and such a high priority for us.
Absolutely. Thank you for that, Jim. Our next question is simple, but I think really important. We talked about all of these safety measures to protect employees from silicosis. Do those safety measures eliminate the risk, or are they just reducing it?
All
Mark?
of them, yeah, there's no one golden arrow, if you will, that gets rid of it completely, other than possibly the correctly selected respirator at the employee. But that's really kind of in what's called the hierarchy of controls. You want to reduce the most risk earliest on in the process. So that may be as early as recommending to all of you designing with natural marble, which contains very little silica, or the product itself. Moving down that list, it may be things like using the water, using the wet processes, which are fairly simple for most shops to implement. And then getting more defined, there are additional steps, additional filters, recirculating filters, HEPA filters that can remove smaller and smaller amounts of dust and reduce those exposures. But then the last opportunity to protect a worker is at where they breathe in and out. So with that respirator. But then with respirator use, there's a number of additional rules for respiratory safety compliance. They have to be medically evaluated to make sure they can work with a slight restriction on their breathing in an 8-hour work week. They have to have that device correctly fitted for the worker. They have to clean and maintain that device. And then just like any other OSHA standard, they have to have records, training and records of that training in place on a regular and ongoing basis.
Yeah.
Hopefully it answered the question. Yeah.
Yeah. And we advocate so much wet practices, but it's good housekeeping. And we're getting into the weeds of kind of what we talk about with our fabrication community all the time, but there's so many elements to this. I think the big thing we wanted to make sure happened today is general awareness that you as a design professional are not out there on your own. you can turn to our resources. You can advocate that your fabricators utilize the resources and just be an influencer and help us get that message across. And just a tip of the hat, how proud we are of all of you that are already working with fabricators that are doing the right thing. But, we cannot be complacent about any of this. It needs to be an ongoing conversation.
Absolutely. And
Yep.
I would add one more thing. Guys, this is, for lack of a better term, the sky is not falling. We have been able to do fabrication of natural stone and all these other materials for a very, very long time safely. There are some people that have not been good actors, and that has really caused some problem. And it has given us the ability to reevaluate what resources we had and to elevate them to meet the need currently. Like I said at the very beginning, you can walk outside in Arizona or Wyoming on a windy day and get silica exposure from just the wind blowing it into the air. So we have the ability to be safe. And that's really, I guess, the message is that we want everyone to be safe. And
I want to make two more points. Going back to
sorry.
your question, Alicia, about the states.
Yeah.
I don't want to single out any state in particular, but we know California is a little further ahead than the rest with their medical surveillance and things like that. But one of the data points determined from all the cases within California was that they were not isolated, but predominantly immigrant workforce. So one of the challenges was either not having resources available in their native tongues, things like that. So I did want to mention one of the things we did very recently was had all the silicon slab safety certificate courses fully translated, both the videos and the educational portions of that fully translated into Spanish for all of our Hispanic workers. And going along with that, the cases or the worst pockets as we travel, visit places around the country tend to be some of those border states where those immigrant work communities exist. I'm not targeting or isolating them because I've been in other non-immigrant facilities where they have, not the best work practices, but there exists that opportunity for us to help them improve. And in closing, for me, I do want to say there's really only three reasons why a company wouldn't be proactively protecting their worker. One is they don't know.
Yep.
And hopefully through outreach within our industry and through groups like NKBA, we're helping spread that awareness and helping the employers and the workers better understand. The other one I don't like so much, but they know that at risk exists, but they may not care. They prioritize other things over their own safety, and that's unfortunate. Those are the ones that I wish we could reach, but are the most difficult to change. The last one is the ones that don't have access to or haven't reached don't have the ability to protect themselves. That may be for a number of different situations. That's why we created so many of the resources that we have available to be able to reach people in multiple languages, in multiple areas around the country, to let the workers and the employers know about the risk and also how to mitigate it, how to reduce that risk. That's it for me. I'll turn it back over to you, Jim, if you have any other final.
Just Alicia, closing comment for me is I want you all to know that all this work that's being done has been a collaboration across multiple industries. There are trade associations in the porcelain industry, those involved in the engineered stone industry, and of course us in the natural stone industry. We've all come together to work on this and to collaborate together on what is right. And I want to thank personally Bill Darcy and the NKBA team, Alicia, to you for this opportunity. We're going to continue to fight the good fight, bring resources to the table. And remember, we are the NKBA of the stone industry. So we love our members and we love the collaboration and the relationships that our members have with the kitchen and bath design community.
Amazing.
Reach out to us. We're here for you.
Yep.
Really.
Amazing. Thank you to all of you, our speakers, the Natural Stone Institute. Something like this is very important. We appreciate you bringing these resources, this information to us. Obviously, the design community is a big part of getting this information out there and making sure that we're helping with employee safety. So very important. Like I said, everyone will have access to those resources that I listed. We'll make sure to send that out. So thank you again to our speakers, and thank you to the audience for joining us. Until next time, have a great day, everybody.
Thanks, everyone.
Thank you.
Thank you.